My name is James Backstrom. I'm the Chief Medical Officer for Foundation Radiology. I've been asked to basically try to give some rendition as to exactly how Foundation came to be and at least some of the measure of the excitement that we feel about this business model particularly. I started off my career as a physician, and actually what people would refer to as a real doc. That is, I used to carry a stethoscope. And I'd put that stethoscope around my neck, and basically that was the measure of being a physician. And when I tried to make a diagnosis with the stethoscope, it was trying to hear sounds and then envision what that sound meant from the standpoint of actually what was happening inside the patient's body. Over the course of my career, I got involved with radiology, and radiology in the old days used to be known as an ancillary service, a service that was basically relegated to the basement of a hospital, and most people's involvement with radiology revolved around the fact that they would get a piece of paper with a radiologist's name at the bottom, and that would be essentially the radiologist's involvement in patients' health care. Life has changed considerably since then. In fact, in the last 10 years, radiology is no longer seen as an ancillary service, and in fact it's a name that I detest. It's actually become a vital service. There's almost nothing in medicine that can be done without a radiologist's involvement. And the old days of the radiologist being not seen, or the radiologist basically lying behind a door with the lights out, are over. Again, the radiologist used to throw a piece of paper underneath the door, and that was their involvement with patient care. We now see radiology as a very vital part of the way medicine functions. And for us in this model, what we've been able to do, and what is perhaps most exciting, is that we're able to allow the radiologist to not only work in a very highly efficient background and produce subspecialty reports that really impact the care of the patient on a day-to-day basis, but we're also able to have the radiologist be on site and allow direct interaction between the referring clinicians, the radiology administrators, the hospital administrators, and perhaps most importantly, having the radiologist be involved with the patient. This places a face of radiology to the community that we think is both promoting radiology but promoting good patient care, and certainly something that the hospitals have warmed up to significantly. The impacts have been really quite dramatic. In places like Uniontown, which are small community hospitals that sit in the south of Pittsburgh, they would never have access to somebody like a pediatric radiologist. Therefore, these small children with relatively poor families would find themselves having to travel to Pittsburgh, which was both a far distance and a very difficult maneuver for them. Many didn't have cars. They'd have to go to Pittsburgh to have pediatric studies done. In our model, what we're able to do is we're able to provide that service to the hospital and have the patient actually stay in the hospital and have their hip ultrasounds or have their pediatric head CTs performed right at Uniontown, and prevent the patient from having to go basically a long, arduous drive to Pittsburgh. This is a very, very positive thing for the hospital. It's something that the hospitals can promote to their community. It's something the hospitals can market to their community. And again, it allows us as radiologists to be involved in both the vital happenings of the radiology community, but also the vital happenings of the hospital community. And it marries very closely the radiologist to what goes on in the community. A very unique model, and something that in almost any other way that radiology is being practiced in this country cannot be done. Small groups don't have the ability to hire pediatric radiologists. Small groups don't have the ability to hire neuroradiologists. In addition to that, our model allows that subspecialty coverage to be essentially available 24 hours a day. It may be that one group may have a neuroradiologist, but of course he's only working 8 hours a day and he's off for 16 hours. So we have many examples in our files where very complex cases have come in after hours. Those may have languished on a desk someplace for hours, but in our system are read immediately, which allows patients to be taken care of in a very rapid fashion. It allows referring clinicians to make appropriate decisions on the spot to benefit the patient care, and it allows the hospital to really service the community in a way that they can be proud of and which they can amplify to the community, which results in essentially more business coming to the hospital that would otherwise, again, go to perhaps a tertiary care center. One of the things that affects medicine the most currently is a driving of almost everything that occurs related to cost. One of the more exciting parts of what we're able to do is to go to small, struggling community hospitals. And one of the statistics that we like to sort of bring out there is that about 85% of the care of this country are provided by hospitals that are 250 beds or less. And our model is uniquely designed to essentially help these particular hospitals. There are many things that are happening in government right now that put unique pressures on the hospitals. We are one breath of fresh air to these hospitals in that we can come in and often lower their cost of radiology care, and at the same time uniquely up their level of service by providing subspecialization as well as providing on-site care that they would not otherwise have with the model of radiology that has been existing for years, that is a group model of radiology. Places like Uniontown, places like Katanning in Armstrong County, places like CMC in Scranton, and places like Hazleton had a difficult time maintaining radiologists, had a difficult time providing 24-hour coverage for their emergency rooms, and a difficult time obtaining subspecialized care. And in our model, we're able to solve all of those problems in one fell swoop by just having them think of Foundation Radiology. We've been able to provide both pediatric care, neuroradiology care, and expert women's care. And not only are we able to do that from the standpoint of patient care, we can actually also provide support with expertise in buying equipment and essentially provide a comprehensive radiology service package to a community hospital that would be very difficult for them to do without having the depth of Foundation Radiology behind them. In many community hospitals across the country, when a patient comes to the emergency room, there may not be a final report issued for up to 24 to 36 hours after the patient actually has the study. They may get a preliminary report, sort of a basic look at the film. Foundation Radiology is able to reliably give patients and the hospital referring clinicians, perhaps most importantly, a final report in very defined time periods. And these are actually times that are industry leading. We're able to provide reliably reports on all radiology products within 45 minutes of an emergency room patient, within 4 hours for inpatients, and 24 hours for outpatients. And these are really these are time periods that would be unheard of in a private practice group. In addition, we've been able to also offer a last line of service, which is essentially the ability for a hospital to convert something to superstat. So if there is truly an absolute emergency where there's a car accident or there's somebody that is very worried about a patient, our unique CSR team and the relationship that the CSR team, the customer service people have with our extenders and radiologists allow that communication to be given to the radiologist, and those radiologists are then able to actually get some of these very, very superstat films out within 10 to 15 minutes, which again translates into really superb care. And even if you went into a tertiary care center, a UPMC or a Duke, this level of service would be unheard of. And we continue to try to push that envelope further and further to make sure that the information that is obtained by the physician is obtained in a very timely fashion, and a fashion that is both high quality as well as very attendant to the fact that these people need to have their radiology reports in hand as quickly as possible so that the appropriate decisions can be